We extracted literature from 5 academic databases and screened 2,589 studies for relevance to our research question. And after a whole lot of literature screening, we found a total of 26 articles that met our criteria and included IPV survivors as more than study subjects. We found that the studies generally had a small number of survivor and victim co-researchers. Of the studies that reported a specific number of survivor co-researchers, about half of them only included 1 or 2 survivors. We also noted that authors generally referred to a co-researcher group or advisory board that included survivors among other stakeholders, making it difficult to determine a specific number of survivors involved. For each article, we assessed the level of involvement of survivor co-researchers using a tool from the Saskatchewan Centre for Patient-Oriented Research. Essentially, there are 5 levels of involvement in this tool, ranging from simply informing survivors about the research to actively engaging and empowering them in the research project. Of the studies included in our review, most of them involve survivors at the collaborate level, which is the 4th level, with some involving them at the consult or involve level. And it's important to note that none of the studies involve survivors at the highest level. We also looked at the research tasks that survivors were engaged in. Most commonly, they were involved in study design, developing study materials, data analysis, and knowledge translation and dissemination. We also found that most studies used community-based participatory research as their guiding model, and the second most common model was participatory action research. As we were extracting data, we noted barriers and facilitators to engaging IPV survivors as research partners. At the individual level, several barriers and facilitators emerged. For example, compensation or lack thereof contributed to survivors' ability and desire to take on this potentially time-consuming role. Additionally, confidence in themselves and their expertise, as well as in their understanding of the research process, influenced survivors' comfort when participating. At the interpersonal level, respect and trust were very important, as well as challenging traditional power dynamics and increasing equity. As far as organizational themes, the most prevalent were trust between the co-researchers and the research institution, sustained partnerships, and adequate staffing. And finally, it's not surprising that the barriers and facilitators at the administrative level included funding and time. While reading the articles, we noted any recommendations made by the authors for working with IPV survivors or victims as co-researchers. We noted that several suggested the importance of increasing the diversity of stakeholders on research projects, including stakeholder agencies who work with IPV survivors and victims. Also, it's very important to provide fair compensation to recognize co-researchers' time, effort, and lived expertise. And finally, another important recommendation was to develop an understanding of exactly how co-researchers will be involved in the process ahead of time, as well as providing ample opportunities for survivors to take leadership roles.
For the next piece of the project, our team worked together to rate 5 participatory research models. We worked to reach consensus on our ratings of each model in terms of benefits and limitations, as well as the model's flexibility, potential for empowering people with lived experience, and practical applicability. We also looked at whether the models had been used in previous studies with survivors of IPV and any information relating to the survivors' satisfaction with their participation in these studies. Our evaluation found community-based participatory research and participatory action research to be the most relevant for our work. Next, we will be taking what we learned from the evaluation of the different models and the benefits and limitations of each, as well as the findings from the scoping review, to an online roundtable event, as well as focus groups with survivors and academic and community-based researchers. The roundtable event is on Friday, but we will be accepting applications for that until the end of today. If you are a survivor of intimate partner violence and you're interested in participating, you can scan the QR code on the screen or email Ashley, one of the research analysts, at the email address listed here. We also still have room for survivors in the focus groups, so visit the same website or email Ashley to sign up for those as well. And in the end, we will have developed a research-based, co-produced framework for how to engage IPV survivors as research partners. Here are the references for 3 studies that we cited on the slides. We will be happy to share these references and the slides if anyone is interested. Carissa and I would like to thank our team members listed here in alphabetical order. Also, thanks to SSHRC for funding this project and Ava for providing funding through an internship for a research analyst. And thank you for the opportunity to share this project. Carissa and I will be happy to answer questions at the end of the seminar.
Okay, great. So I guess I will just go next, everybody. Let me start sharing. Thank you for this amazing. Okay. Good morning, everybody. I hope you're seeing my screen very well. Right? I hope so. Okay, perfect. Just 1 second. Yes, okay, perfect. Thank you. Okay, so good morning, everybody. My name is Daniella, and today I will be taking, sorry, here we go. Today, I will be taking the theme of collaborating in the research for IPV community a little bit different and talk about one research that Dr. Elnas Mohimi have been doing and that I have helped with. So today's conversation will go into understanding the different risk factors of intimate partner violence, survivorship, and perpetration through a biopsychosocial lens and how it actually helps us to understand IPV and have contributed to the IPV research community. So today's conversation will go through some of the background information, followed by our research objective and method. Then what we're actually trying to get out of it and how we can help the community, and then some of our preliminary findings. So we talk about it a lot this morning. So IPV stands for intimate partner violence and can be characterized by physical, sexual, emotional abuse, as well as controlling behavior between intimate partners. So historically, research has been focusing on women as the victim, but researchers have started to see the bidirectional violence of it and how men and women can both equally be affected, although a little bit differently. So why is it important? So when we're looking at the global scope, 23 to 31% of women and 3.4 to 20.3% of men have globally been affected by IPV once in their life. This number, we have saw a marked increase of IPV rise for 33% in only 3 years, from 2019 to 2021, which we could contribute to the COVID-19 effect. So the stay-at-home order might have increased the IPV cases around the globe. And so this crisis can be described as a pandemic without a pandemic. So where is the issue? What is our research trying to aim and trying to look for? So with all those rise of IPV crisis, we have those rise of research going into the community. Those researchers trying to help the IPV community by doing new studies, trying to see how we can implement all of this for the survivor. However, we have one big challenge, which is the disorganization of information. There's no comprehensive review of the IPV risk factors that have been coming out since COVID-19. So let me give you a little bit of breakdown of how this disorganization might have occurred. So of course, we have the COVID-19 happening, and then that's led to a lot of research, a lot of publication on new topic, new ways that might affect and that might lead somebody to be vulnerable to the IPV relationship. And so this lead to disorganization and no real framework of all those findings. And this unfortunately led to making it difficult for researcher, difficult for policymaker to actually have something tangible to work with. And I hope you guessed it. Unfortunately, that also led to slower intervention, slower finding of research, slower survival that receive help and prevention that will have clear direction and know where to go. So with all of this, our research objective is to be able to organize and map those biopsychosocial risk factors of IPV post-COVID-19 by focusing in two areas, survivorship and perpetration. So I mentioned a little bit about it in the beginning of my presentation, but what is it? So the biopsychosocial model is trying to approach a different concept by saying there's not one factor that can lead to be an IPV relationship. There's the interaction of biological factors, social factors, and psychological factors. And this model is very important when we're looking at IPV research, because as I mentioned before, it's aimed to explore that not a single factor is important, but all three combined. For example, biological factors might be 1% genetic. Social factor might be low socioeconomic status, be exposed to in a violence environment. And psychological factors might be having past traumatic event. So our research in general is aiming to take all those factors and trying to see how it influences IPV. So our research method, can be described as a three-step design over a 2-year timeline. So this means that we started with a systematic search, different papers. Then we have an abstract and a full text screening. Then we finish with some data extraction where we can work with all those risk factor findings to actually get something out for the community to work with. So all of this, we use the Confidence app website to be able to use for the data extraction screening. And we have to make sure that we're actually looking at all those papers critically. And so we always have 2 reviewers and 1 conflict resolver at every step of the way. And one way that we're trying to be intentional and be able to build a community out of this whole project is having an amazing big team. And then since the beginning of the start, we have at least 10 members that have touched this paper and be part of it. So I talk about being intentional with our papers. So we also have obviously eligibility criteria for the literature we're going to include in our research. So as I mentioned before, there was a search of papers. So that means that we have to have some inclusion criteria. So we include papers that are full text primary article published between 2020 and 2023, have focused on risk factors of IPV, perpetration, and or victimization. The IPV have to occur in a romantic dietic relationship for a partner older than 12 years old. And we need to have a specific factors who's increasing IPV. So as much as we're including papers, we're also rejecting some papers. So those who have no explicit mention of risk factors, wrong comparator, wrong populations, wrong outcome, not a primary study, or not a full text article. So let me get you a little bit of our process and what our team have went through. So we started with a big chunk of paper. And then we cut it out. And then we're like, now we're going to focus on the title and the abstract screening. Then we say, that's not enough. We come it down again to some full text screening. And so now that we have some papers, we need to, again, cut it down. And so now we're approximately around 200 papers ready for some data extraction. And so now that we have those papers, what are we actually trying to get out of those papers? So for data extraction, we're trying to see the journal and publication year, the country or region of focus, the purpose, the study design and data collection year, the population and sample size, participation mean age, IPV type, and obviously the biopsychosocial risk factors. So, I'm sorry. Let me get a little bit of what we have so far. So we have been doing some of the data extraction for our papers, and so far we only have a result for the survivorship part of it. So when we're looking at the biopsychosocial model, for the biological factors, we actually don't have any information so far. So there was no risk factors that have been associated with the biological factor, but we're still hopeful to find some as we are getting into more different papers. Then some of the social factors. We found that isolation and socioeconomic status might lead to be a risk to be in an IPV relationship, which a little bit makes sense when we're looking at isolation, because if you not have your supporting social cycle, you're more at risk to be in a relationship where people can consider it as toxic and being a victim in that relationship. One interesting finding, which is still preliminary findings, is that some risk factors do not identically translate in different regions of the world. For example, we found that depending of your socioeconomic status, so if you consider high income to low income, Western region, we found that having a lower socioeconomic status will increase your risk of IPV. However, in certain Eastern region, a higher socioeconomic status will increase your risk of IPV, which is very fascinating in my opinion. So we're still working on trying to find all of those key findings to be able to use it for the community and the research community, because it's interesting to be able to see the different way one person culture might affect their risk to be in an IPV relationship. And then the last one is the psychological factors. We found that having some poor marriage satisfaction or increased workload might increase your risk to be part of an IPV relationship. So So what are our next steps? Obviously, I hope you understand it. We need definitely more data. We are still trying to do some deeper analyzing of the partner and the correlation that we have. So we'll be getting into it. And then we are hoping to be able to use all of the data to make some recommendation for policy and intervention strategies. So the next step is, what are we trying to hope for? How are we going to use this paper to actually help and be intentional for the IPV research community? So we want to be able to synthesize all those post-pandemic IPV risk factors to lead and guide future intervention and public health policy. So before I finish, I really want to take 30 seconds to be able to talk more about another part of be intentional about research community, and talking about my experience as a student in research. Because as you saw before, they will have a team of more than 10 people coming in. And as we're trying to be a community in itself in our project, it was very interesting to see how be including students in a research like this one, it's have a positive impact in my life in a sense. So I joined Dr. Anas Mohimi late 2023 through the Waypoint Student Placement Program, and I have help with the Pumpy program. If you don't know about it, we'll be happy to talk about it. Amazing. And then we work on the IPV research. What I'm trying by being a student
It looks like we may have, yeah, lost Daniella. We can certainly circle back to her once she has a chance to reconnect. Would the team like to continue with the next presentation?
All right, I'm just gonna set it up real quick. And are we good to get started? I'll take that probably as a yes. So, hi everybody, and thank you again for having us for this presentation. Today, we're going to be talking a bit about how partnering with community organizations in IPV research is important in building trust and addressing some of the barriers to recruitment, and in general, just supporting inclusive properties. So in the Simcoe-Muskoka area, it has experienced a 30% increase in incidents of intimate partner violence. This has been accompanied by growing evidence that highlights the need for specialized services aimed at addressing IPV perpetration. However, there's a significant lack of data on how researchers, communities, and service providers should address these service gaps. Moreover, the need of those most directly impacted by IPV are often overlooked or underexplored. So, equity denied communities, including individuals who experience barriers to equal access, resources, and opportunities, or face additional issues like stigma, economic instability, immigration challenges, and cultural barriers, can often amplify the risk of IPV. Now, in general, what are the people saying and what have we done? So we've received funding to conduct the Intimate Partner Violence Service Study, which is a joint effort between Queen's University and Waypoint Center for Mental Health Care. In this study, we are interviewing 30 individuals who have either perpetrated and or are victim or survivors of intimate partner violence in order to explore their experiences and views on current services and the cares available to them. So these individuals have to be 18 years or older, living in or close to the Simcoe-Muskoka region of Ontario, and this includes the Greater Toronto Area, and had to have experienced and or engaged in intimate partner violence in a romantic relationship lasting at least 3 months. We initially opted for individuals impacted by IPV in the last 2 years to avoid recall bias, but we realized that some participants were very adamant about sharing their experiences and therefore expanded our eligibility criteria to include them. So individuals who experienced IPV could self-refer to our study, and those who only perpetrated IPV were required to have completed and or be referred by rehabilitation program representatives. So, big question is, why has recruitment been so challenging? While we have been conducting this study, we've realized that more often than not, it would be survivors or victims that were inclined to participate, and that it was really challenging to recruit those who had perpetrated IPV. We've realized that there were multiple barriers contributing to this, including access issues, confidentiality concerns, safety, legal considerations, and a general lack of trust. So we found that emails and social media were just simply not enough to recruit from this unique population, and we needed to leverage human connections. So we went back to the drawing board and decided to place a greater emphasis on the precursor step of relationship building. While relationship building can sound straightforward in principle, it was much more challenging in practice. So we turned to the literature to see how others approach this issue. We did find limited guidance, especially when it came to the tangible or actionable steps that we could take. So through a process of trial and error, we navigated this journey ourselves.
And so when we talk about relationship building, we focused our efforts on community service providers who interact with individuals who engage in intimate partner violence. And we chose this approach because once intimate partner violence occurs, those who engage in violence often come into contact with community service providers through counseling or rehabilitation programs, whether this is something that's mandated or whether individuals seek out these services voluntarily. And as a result, community service providers become key players in connecting with individuals who may otherwise be difficult to reach. So this positions providers as gatekeepers who facilitate access to this hard to reach population. And so two key partners that we've worked closely with and that we base our understanding of relationship building on are the Barrie Native Friendship Center, and they offer the I Am a Kind Man program and the Partner Assault Response program. These collaborators helped us address recruitment disparities for individuals who engage in intimate partner violence. And now we're sharing with you what worked for us, hoping that it can serve as a helpful guide to your own path for building stronger relationships in research. And so one of the first ingredients needed for relationship building is the concept of gemba. Gemba is a Japanese term that means the place where value is created, and gemba is a term that's often used in more business and operations kind of areas, but we also found that it was highly applicable to relationship building with gatekeepers. In the context of relationship building with gatekeepers, the concept of gemba is all about going to the real place where value is created and the environments where people are actively receiving services and engaging with support systems. And so why is this important? Well, presence is key in establishing trust as it demonstrates that you are generally interested in understanding the realities that people face. Through this process of going into the real place where value is created, it helped us build rapport and open lines of communication. And in this way, we engaged more authentically with gatekeepers and creating a space where communication is really natural and candid, which we found to be essential for fostering trust, understanding, and collaboration. And so for us in the IPV service study, this looked like going door to door with our recruitment flyers to make in-person connections. This was something that was received really well, and we were able to make connections with service providers who were less accessible via email. We also attended in-person meetings and did site visits to strengthen our connections with community service providers. During this meeting, we had opportunities to tour different organizations, to meet service workers, and to engage in really authentic conversations about ongoing issues in terms of service delivery as it relates to intimate partner violence work. And lastly, in some cases, going to the place of value meant connecting via Zoom, especially for organizations where community service providers may have been working at multiple sites or they were just too busy to make time for an in-person meeting. And so we also learned that just as trust is essential with gatekeepers and those who engage in intimate partner violence, it's equally vital to have trust between researchers and gatekeepers. Importantly, gatekeepers are highly protective of the clients they serve, and before allowing researchers access, the gatekeepers we worked with requested the implementation of specific measures to ensure that client safety, confidentiality, and comfort were prioritized. To ensure that rapport is maintained and respected, researchers engaging in this kind of work need to be responsive to these measures and demonstrate a willingness to adapt their approach in ways that align with gatekeeper concerns and respecting ultimately their expertise and prioritizing their input, which also strengthens collaboration and ensures ethical and responsive engagement. And then in the context of the IPV service study, this meant changing our language from using the word perpetrator to those who engage in intimate partner violence. Further, it also involved giving individuals some choice back by letting them decide who interviews them. So we created a researcher bio sheet, and individuals were able to choose who they felt most comfortable being interviewed by. It also meant that we needed to be flexible and to allow participants to have their cameras off during interviews. And lastly, we amended our research ethics board protocol to permit elders or secondary support individuals to be in the interviews. And in our work with gatekeepers, we discovered a shared goal, which was ending intimate partner violence. And by leveraging this common objective between researchers and community organizations, We can bridge relational gaps that often exist between researchers and service providers. And I think this is especially important because there are misconceptions that researchers are disconnected from real-world issues. And by highlighting shared goals, we help to demystify this perception. And in the context of the IPV service study, emphasizing the mutual goal of ending intimate partner violence actually helped transform a reluctant community service provider to actually secure their buy-in and support for the project, which created a new recruitment avenue and referral pathway.
And so, what has been the general outcome of our efforts? Well, to start, we built sustained relationships with our gatekeepers that effectively address the very barriers that influence participation in the first place. In turn, this led to the successful recruitment of a hard-to-reach population whose participation helped highlight some significant nuances in our data, including the interlinking of mental health, substance use, and intimate partner violence. Additionally, it also showed us just how often experiences of perpetration are interwoven with experiences of victimization. Now, looking at the bigger picture, these partnerships have helped our team develop a more compassionate approach with our study procedures, build amazing relationships with different equity denied communities, bridge the connections between research and community organizations, and most importantly, this process has helped us provide a safe space for all individuals impacted by intimate partner violence to share their stories to inform and influence services available. So, as we build these relationships and engage with the intimate partner violence community, it is important for us to understand and reflect on our responsibility as researchers in disseminating the data that we do collect. More specifically, our role as researchers is critical in acting as the mediums between those with lived experiences and the lay public. So, it's important that we reflect on how we can ensure that the data we present advocates for those with lived experiences and inspires and/or contributes to a positive change within the field of IPV. So, where's the road taking us from here? We've seen an increase in the number of referrals as of this project. So, of the 17 individuals who have engaged in IPV, 16 of those participants were referred from our gatekeepers. This was more than our original goal, which was to recruit 15 individuals who engaged in IPV. We're also investing in events to strengthen our knowledge, mobilization, and relationship building efforts, bringing together researchers, organizations, and people with lived experiences. Events like this seminar series help in the dissemination of our knowledge and further allow us to strengthen the relationships we hold both with the IPV community and the various organizations that are within that field. Our team is also engaged in skill training and publications to share our learnings with other researchers. In addition to our findings on the IPV service study, we are also co-writing a commentary on relationship building with those who have engaged in violence, leveraging lived experiences from researchers, gatekeepers, and those who used violence. In addition to helping develop our own network and projects, our research has provided a foundation for collaboration with other organizations, institutions, and individuals, which in turn has helped enhance the impact this research has in other fields. Collaboration with institutions such as Queen's University, and more specifically, organizations such as Queen's University Online Psychotherapy Lab, has helped research in digital health by further opening up the discussion on service accessibility within mental health care. Overall, these efforts have been critical to expanding our connections, networks, and general outreach within communities. Working with individuals, gatekeepers, institutions, and organizations within this field has been a key factor in the development of these networks and continues to be a vital component in our research to this day. Ultimately, we hope that this multifaceted approach is sustainable and carries with it short and long-term benefits, including the eradication of intimate partner violence through effective services. So we do just want to note that we are also actively recruiting for this study. And if you have any information or you wish to contact us, feel free to reach out at the email shown on screen, or you can also just scan the QR code, which will take you to the self-referral and study detail page.
Sorry, it was muted. But we're open to taking any questions at the end of the seminar, or you can save your questions and email them to myself or Alex. Our emails are just listed on the screen there. But thank you so much for having us speak at this webinar, and thanks again.
Hi, everyone. I see Daniella has had an opportunity to join us. Daniella, would you like to take a few minutes to wrap up your presentation?
Yes, thank you, and sorry for that. Oh my God. Yeah. Okay, hi everyone. Welcome back again. So I was talking about my experience as a student in research. So I'm not so sure where I stopped, but I believe I was talking about my skills that I have learned when I joined the team as a research. So I was talking about how I learned a lot of data analysis skills, confidence in academic writing and today presentation also, and also building professional network. So building professional network is really hard to me because since I joined the team in 2023, I always met Dr. Anas Mohimi since on screen, but I had the amazing opportunity to actually meet her in person last March. So 2 weeks ago at one of the AMI conferences in Vancouver, which I was able to go with KMH to present another type of work. So I wanted to say just in general how it is very important to include people with life experiences when you're doing research. But I felt also including actual students in research not only promote the actual research in itself, but allow to help them gain some like professional developing at the same time. And so that was the last point I wanted to share about our research. So it was thank you everybody for the time. If you have any question, please feel free to reach out to Dr. Anas Mohimi or myself. And we also have some reference pages in case there's some of our information you would like to dig deeper into it. And that was it for my presentation. Sorry for the end of the Wi-Fi situation. Thank you.
Hi everyone. So this is the last presentation. My name is Jaden, and I am one of the student designers and researchers on this project. And I just wanted to come on here to introduce our IPV story, which is a collaborative platform advancing intimate partner violence research. So I just wanted to begin by introducing our team. So that includes Elnaz and Christy. It also includes Amy, who is a communications and digital media specialist. Also on the team, we have Niku, who is another student designer and researcher as well. She is a med student at Queen's University and has a background in design. As for me, I am a graduate student at Elke University in the Design for Health program. Oops. So what is our IPV story? So we are a collaborative platform creating spaces for people with lived experiences to feel empowered to share their stories. We do this by combining digital media and design approaches to improve knowledge translation. And we are taking a multimodal approach with social media, online events, and an in-person symposium. And so in the next slide, I'll share a video with you, which summarizes our IPV story. Introducing our IPV story. Our IPV story is a collaborative platform advancing intimate partner violence, IPV research, and advocacy through lived experiences, innovative resources, and community-driven solutions. IPV affects millions worldwide, yet its complexities often go unnoticed. This important topic is often surrounded by stigma that is rooted in false beliefs about IPV and the people who experience it. To reduce the stigma, representation is essential. 1 in 3 women and 1 in 4 men experience IPV in their life. Survivors' perspectives remain underrepresented in research. Thus, there is a need to bridge the gap between researchers and people with lived experience to create a space for meaningful stigma promote equity for survivors. Our IPV story is a joint project with mentors and collaborators from Waypoint Center for Mental Health and Queen's University. This project is also funded by the Social Sciences and Humanities Research Council. At our IPV story, we believe in the power of stories to drive evidence-based research, influence policy, and inspire collective action. By creating a platform that provides a safe space for storytelling, knowledge exchange, and community partnerships, it can lead to more comprehensive findings and improved services while also increasing trust, empowerment, validation, and hope. How are we doing this? By sharing stories that are submitted to us and using social media platforms to raise awareness and connect with fellow researchers and people with lived experience. We are also hosting an in-person event at the end of summer 2025 that will create conversations for change. Join us in creating a change. Your story is important and we want to hear from you. Visit our website at ripvstory.com and connect with us on our socials to hear stories, challenge the stigma, and help to amplify voices.
So here we just wanted to highlight our website, and we encourage you all to visit our website at ripvstory.com, where you can learn more about our project and our initiatives, as well as upcoming events. We also encourage you to follow us on our social medias, including our Instagram, where we post about content related to IPV and co-research, and as well as promote upcoming events as well. And so one of the key aspects of our IPV story is storytelling. So in the next video that will follow is just explaining why storytelling is important and how people can get involved.
At our IPV story, we believe in the importance of storytelling. Through the sharing of stories, we are able to connect with others on an emotional level and learn through the experiences of people who have experienced it. If you have a story, we want to hear from you. Share with us stories of empowerment, stories of resilience, experiences about IPV and or co-research, or even words of wisdom. To share your story, visit our website at ripvstory.com. Click on Share Your Story. Using one paragraph, enter your story in the description. You can also send your story to connect@ripvstory.com. After submission, our team will review your story and ensure no identifying information is included to protect your rights. Connect with us on our social media and visit our website to read about the stories shared by others. We look forward to all the storytelling that is about to unfold.
And here we just want to highlight how it is that people can share their stories. Also, I apologize for my video, but what you can do is by clicking on Share Your Story, you'll be given prompts about the different types of stories you can share. And by scrolling down, you can type in your story and submit it to us. But you can also, if you feel more comfortable, you can send us your story through connect@ripvstory.com. And so finally, I just wanted to share with you all some upcoming exciting events and initiatives. So I'll actually start by discussing our big event on August 17th. So our IPV story is hosting an in-person event called Storytelling for Change, a community event. So we invite you all to join us for an in-person event to discuss how partnering with survivors of intimate partner violence can drive transformative research. So during this event, it will give everyone a chance to network. We listen to guest speakers. There will be art and entertainment, and of course, lunch and refreshments will be included. So in preparation for that event, the event will be held in Vaughan, Ontario and at a banquet hall. So in preparation for the event, we are partnering with Prom Glitz during this upcoming Friday and Saturday for a dress try-on. So we invite you all to come in to try on dresses that have been generously donated for this event and for you to try on and take home. And so the event will be held April 4th from 3 to 6 p.m. and April 5th from 9 to 3 p.m. in Barrie. And so cash donations are accepted, but we do invite you all to come in and find the perfect attire in preparation for our upcoming event in August. And for the August event, please stay tuned as more details are to follow. Thank you so much.
All right. Thank you so much, everyone, for your inspiring stories of how you're leading this new research and engaging those involved in intimate partner violence. We do want to take the opportunity now to open up for questions. So far, we've only had one that I'll bring forward, but I do encourage you, if you have additional questions, please share them in our Q&A section, or we'll also monitor the chat. The first question did come up during Daniella's portion of today's presentation, but I would certainly encourage any of the other presenters to also chime in. The question is, they're wondering if there's any attention paid to the impact of religious perspectives on relationships. It would be interesting to know if religious ideas increase the possibility of IPV, as many religions do have a patriarchal framework. Wondering if there's any perspective on that from our panelists.
Okay, so for our research, since we're still on the data abstraction part, so we don't have any we don't have any data that supported that the religion might be a part that can influence being a risk to being an IPV relationship. But as I mentioned before, since we're still into the data extraction, we might find some results or we might not. So it's not something that we are actively either looking for it or not, but it's something that we might find depending of the results of the papers. But that would be a very interesting thing to find.
I'll just add to this question a bit. And this isn't from, I haven't studied this specifically or delved into the research on this specifically, but it's definitely come up in some of the studies that I've conducted with survivors where religion is a piece or it's one of the many intersecting barriers that can make it really hard to end a relationship where someone is experiencing IPV, to reach out and get support. For many people who are part of a strong faith community, I've heard examples where they have reached out for help and support and not received a good response, where sometimes people who are trusted individuals in their faith institution, in their community, have used that rationale to say, well, you should keep the family together, you should stay in the relationship, and that has been very, very difficult and has led some survivors to feel like they've had nowhere to turn. It's limited options in terms of seeking support sometimes. And for victims and survivors of IPV, there's often so much to give up when trying to seek safety, where trying to find safe housing, sometimes having to leave the community, sometimes having to sever relationships with friends or extended family. And so when they and their partner are part of the same place of worship, that's another thing to give up. Sometimes feeling like losing those community connections, like people won't support you, or it's just not safe continue to go and worship there. So that all absolutely plays into survivors' experiences of help seeking. It plays into the way that bystanders and natural supports and friends and family sometimes react in a positive way or a not so positive way. And then also for people who use violence, that is something that happens where they will rely on, erroneously on the beliefs of their faith and to justify their behavior when that is not what the faith or the religion prescribes, but they will try to twist that to use as justification for their use of violence.
Thank you so much. Our next question, one of our participants is curious to hear more about the experiences of those who have used IPV, so the perpetrators, and how it went with involving them in the IPV service study. So I don't know if there's an opportunity to elaborate here, if there's maybe other opportunities in some of our subsequent presentations to learn more. Panelists?
I could actually jump in to talk a little bit more about this because I've worked a lot with those who have been using violence in interviews. And I do have to say the response and the engagement we have had with these individuals has been very positive. They're very open to sharing their experiences. And I think a lot of the time, what has been mentioned is that they do have dual experiences, and it's a situation where they were the last person to get to the phone, so they couldn't report their incident. And then so they were, charged, and a lot of people demonstrated like we've had several people say that, we have been accountable and I'm here to share my experience, and what better way to, have more services, because a lot of them are commenting on like there's not enough services. Like there were two programs, like the PAR program and the one through Barrie Native Friendship Center for all of Simcoe County, and that's not really enough. And we've heard from our partners through PARS that there are groups running. It happens more often than not that there are multiple groups running at a time, and that their staff are, struggling to keep up with the demand. So I think they really appreciate being asked what they think the solution is and what they. A lot of individuals say that they want to be involved in reviewing the manuscript before it's published because they want to see what comes out of their contribution. They've asked if we were doing any other studies, and they want to be involved in more research if they can, which has been awesome. And as we kind of said in our presentation, we have a few individuals who are interested in participating in a commentary. So we're going to include their lived experience directly into the paper about, IPV research and being involved in it, and what it means for them, as a very stigmatized population, to be involved in something like this and to have their voice shared. I don't know. I know Elnes has done quite a few interviews as well. I don't know if there's any parts I haven't kind of addressed there, if there are any more specific questions, but yeah, overall the response has been very positive, and I was personally surprised at the level of engagement and just the enthusiasm for the research. So yeah.
Yeah, I think Ashley, you summarized it perfectly. Even within a team setting, it really does remind us of how important it is to be compassionate and create a space where individuals feel safe to share these experiences, because the main intent is for us to drive change and to create or develop and implement services with our communities that benefit our populations and the populations that we work with.
Thank you both. All right, we have another question. How can we ensure the usefulness of IPV research for our target population? Research can sometimes be limited to the academic space. What are some examples of how research findings have been turned into tangible interventions and services?
I'll go ahead and jump in first, and I'll be brief and see if anyone wants to add to this. But we've had a really fantastic opportunity conducting research at PATHS because we are the Provincial Association for Domestic Violence Shelters and Counseling Centers. So there's that automatic knowledge translation piece where in the research that I work on, I'm able to first get the input from those professionals who do the work, what their questions are, what we should be looking at to support their work at the outset. But then when we have research, automatically sharing it with them. And, pieces of that may inform their work or may be able to help them to improve service provision. But also, I think the most important thing is always having recommendations and really clear recommendations in the research. And usually there's multiple levels of the recommendations that we have. So for service providers directly, sometimes depending, things for perpetrators or people who use violence or victims and survivors to think about or to be aware of, and also recommendations for different levels of government. And so that's really important to be clear what those asks are. It doesn't mean it always gets picked up, but providing that evidence and then clearly communicating those findings and the basis for why we're making those recommendations with those decision makers has been really effective, and I think has been appreciated.
And I'll just add a little bit of information about the ODAR specifically. So yes, although it was created more in the academic space, but also with practitioners, it has been turned into an instrument that helps those who are supporting women with lived experience of IPV identify the risks in their own relationships. Women assess their own risks all the time and the risks to their children, but sometimes they are not fully aware of all of the pertinent risk factors that identifies a higher risk situation. And sometimes women underestimate their risk. And research with the families of women who were victims of femicide found that in maybe half the cases, they really didn't expect this kind of thing. Not that we want to put the responsibility on the women to expect and plan and so on, but offering a risk assessment tool like the ODARA means that when survivors do reach out to agencies, they have a way to bring in more information that helps them assess their risk and that can support them in their safety planning and decision making.
Wonderful. Thank you so much to our panelists. Let's go to a quick close here. So this has been a really informative and inspiring session today to hear all of the great work that is ongoing. We thank everyone for joining us today. Recordings and slides will be available post-event on our website. We will be also sharing a post-event survey that we would absolutely welcome your feedback. And if you have any suggestions for improvement or other future sessions, please, by all means, share those with us. We also have certificates available for participants. If you'd like to contact Christy Allen, she'd be more than happy to help facilitate the issuance of that certificate. We will follow up post-event with an email to everyone with some exciting information on the next session in our series, which will be hosted April 8th. If you haven't yet registered and are interested in doing so, we'll share the link in our chat here, but we will also ensure that we're including it in that email. There will also be 2 additional series presentations available, and we'll communicate those out to you as well. We hope you all have an amazing rest of your day and rest of your week, and hopefully you all are staying safe and warm today. We wish you all well. Take care.